Today, we are visiting with Dr. Ernest Rosenbaum, a Mount Zion oncologist since the 1960s. Dr. Rosenbaum was graduated from the University of New Mexico in 1951 and received his MD from the University of Colorado School of Medicine in 1956. After an internship and residency in San Francisco and some time in the Air Force, he went to Boston on an NIH fellowship in hematology, working with the renowned hematologist William Damashek. After completing his fellowship, Dr. Rosenbaum returned to San Francisco, and at Mount Zion he joined John Sampson in his practice. We asked Dr. Rosenbaum what it was like practicing at Mount Zion then.
Actually, it was very exciting because it was a very academic place. It was the leading hospital, I thought, for internal medicine, and as a private hospital, it excelled in training residents as well as academic academia, I would say, and it offered a lot of potential for people who wanted to teach as well as practice medicine.
Before the 1960s were over, Dr. Rosenbaum was the key figure in the development of the medical oncology service at Mount Zion, and he was named as its first director. Dr. Rosenbaum told us about a special project he is working on now.
The current one we're trying to develop, and I hope that the Resource Center will take on this project, is survivorship. Patients who have had cancer have to face the next 10 to 20 years of their life worrying, will the cancer come back? And the risk is up to 25% of either recurrence of cancer or new cancer developing, as well as how they should be followed. What are the guidelines? What tests do they need every 6 months or every year, and how to be followed? And this has been worked on nationally. There's a national program for the last 20 years of survivorship.
Dr. Rosenbaum's dedication to his patients and his extraordinary commitment to their supportive care led him to co-authoring numerous texts, most of them with his wife, Isadora Rosenbaum.
Well, actually, it goes back to about 1973, where we started writing a book, and it was our first book, Living with Cancer, which was published in 1976. And people hadn't somehow addressed this topic that if you have cancer, there is life after cancer, and also how to deal with the problems that you undergo when you're being treated with cancer. So this book actually started a career change to help educate the public as well as promote better care for cancer patients who have to live with cancer.
We also asked Dr. Rosenbaum to tell us about the origins of one of Mount Zion's most successful supportive care programs, Art for Recovery.
And in 1988, I interviewed Cindy Perlis, who is the current director of Art for Recovery, and I hired her to set up the art program, and we worked together in writing a book, 2 books actually, on Art for Recovery. And then Cindy has just taken the program and made it one of the most successful programs here at Mount Zion.
Next, we asked Dr. Rosenbaum who are some of his favorite Mount Zion people. He named Harris Fishbon, Russell Tatt, Jack Gordon, and especially John Sampson.
The first was John Sampson, who was a giant in cardiology. He was president of the American Heart Association, California Heart Association, International Heart Association, and I joined him in practice. And although I was a hematologist, he had originally trained me to be a cardiologist.
Dr. Rosenbaum's life has not been all medicine. He is an avid supporter of the arts and has been a medical consultant to the San Francisco Opera since 1966.
And I've had the privilege of being the medical consultant for the San Francisco Opera since 1966. Jack Gordon, who was pulled the curtain, was a part of that. And he got me as a curtain puller, and this means at the end and during the acts of the opera, you attended to how the curtain was pulled for the encores.
And finally, we asked Dr. Rosenbaum what was special about Mount Zion.
Mount Zion was a wonderful hospital. It offered a wonderful blend of clinical practice, clinical research, and basic science research. And we actually, with the medical oncology service, had the opportunity of participating in all three areas. It was a very enjoyable part of life, but the thing about Mount Zion was it opened the doors. It was, for me, unrestricted. I was fired twice as chief of oncology, and Sidney Levin was then chief of medicine, and he wouldn't let that happen. So I continued on to 1976 as chief of oncology, and then they made a lot of major changes at Mount Zion, and Dick Cohn became then chief of medical oncology. It was a very active service. It served a lot of people and was a great resource, not only for research, but for also clinical treatment of cancer patients.
Dr. Rosenbaum's professional lifetime commitment to cancer research, Mount Zion, and especially to his patients was formally recognized in March 2006 at a celebration announcing the newly created Endowed Chair in Medical Oncology in honor of Ernest H. Rosenbaum, M.D.